Hi, are you one of the millions of women who's been diagnosed with masses in your breast? If you are, you deserve to hear these incredible results that happened for this lovely lady who came to my clinic here in South Florida. My name is Dr. Lonnie Herman, and she had a mammography scans. We'll show you those right now. Her mammography scan from January of 2020 revealed that in her right breast, look at this report showing you right up close in this video. The right breast had 3 masses. One of them in the right breast was at 3 o'clock was 6 millimeters. One of them at 5 o'clock was 6 millimeters. And one of them at 10 o'clock was 3 millimeters. In this scan also from January of 2020, in this ultrasound, it showed that her left breast at 2 o'clock was 9 millimeters and that at 11 o'clock was 3 millimeters. Now in her mammogram from the same day, let's look at that image right now, January 10th of 2020, the mammogram is showing that she had this mammogram done in January of 2020 as a reference, as a comparison to what they already discovered back in May of 2019. And in this mammogram from January 2020, it showed that there was only one mass at 4 o'clock in the right breast of 9 millimeters, and it showed that the left breast had at 12 o'clock 12 millimeters. Now in this addendum to this mammogram report, it says that an X-ray report which is negative for malignancy should not delay a biopsy if a dominant or clinically suspicious mass is present. This woman, Luisa, never got the biopsy. One more time, in the mammogram, it showed that there were 2, one in the right, one in the left. Her ultrasound showed that there were 3 masses in the right breast and 2 masses in her left breast. Now again, the doctors advised the biopsy that she did not take their advice. I'm not saying what to do or what not to do regarding a biopsy. All I'm telling you is she, Luisa, decided not to get the biopsy. Her final report that we just got back after now following 4 protocols from the care here in my clinic that I designed for her, April 22nd of 2022. You can see here the ultrasound assessment and the mammogram assessment. And so the mammogram assessment says that the findings are no dominant breast masses. That's right. No dominant breast masses. In her ultrasound from April 22 of 2022, the ultrasound assessment of the right breast fails to reveal any significant cyst or breast mass. The ultrasound assessment of the left breast fails to reveal any significant cystic or solid left breast mass. That's awesome. So we're going to split this into a few different segments. Number 1, we're going to take a break in just a second, and you can listen to what I discussed with Mrs. Luisa, what we discussed here in my clinic recently after we got the report back from the April appointment that showed that the masses are gone. So you're going to take a break. You're going to listen to what she says, and what I said was I discussed this with her. It's very quick. And then we're going to come back from that break, and I'm going to make you a free offer, something you can get right on my website that you can get for free today, right now. And then after that free offer, I'm going to take you through a journey from one ultrasound and mammogram to another ultrasound and mammogram to another, and to the final 4th report, or the 4th study that showed that it was totally gone. So you're going to hear the transition of what her breast went through. Furthermore, I'm going to describe just a few points of my unique exam findings that I discovered with her that helped her get her to completely resolve, to completely eliminate very safely with no surgery and no medicine and no radiation, to resolve these masses in her breast completely with my method. Let's take a break. Let's hear what she has to say, and then we'll come right back, make you that free offer, and tell you some more information. See you in just a bit. Hello, and welcome to another amazing video that I've got to share with you. My name is Dr. Herman. I'm with a great patient. Her name is Luisa. She came to my clinic a little over a year ago, correct? That's
correct.
Yes. And now with only using my treatment that I provided her, the mass in the right breast disappeared. And the masses in the left breast also disappeared.
Yes.
Right?
Yes.
We have proof of this on reports that I'll be showing you in another video. But right now, we just want to hear, Luisa, did you have any other treatment from any other physician?
No. No.
And was there any medication?
No medication.
Only treatment with me?
Only treatment.
Was there any surgery to remove these masses from the breast? Was there surgery?
No.
Cirugía, no surgery. No cirugía. So you're, right now we see these masses are gone.
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 Yes.
And so it was only from this treatment with me?
Yes, only with you.
Thank you.
Thank you.
So we just wanted her to share with you that there was no surgery, no other medication, no radiation, no x-ray treatment.
Nothing.
Nothing else. Only
Nothing
this.
else.
Okay.
Only with you.
Thank you. So we're going to, and thank you for getting on camera with these people, because women need to know it's possible.
I know.
Yeah.
A lot of women need to.
Yeah. So I'm going to get to another video right now, and I'm going to share with you what I did and how this service that I provide people worked for her and how it can possibly work for you too. See you soon.
See you soon.
You can go on my website and download my book for free. But how you can reclaim your health, how you can use quantum energized medicine protocols to actually reverse seemingly incurable chronic illnesses or chronic diseases. Download my book, read it. It's very simple, 40 pages. Maybe it'll take you about an hour. And inside that book, there are a lot of big pictures. It's big font. There's not too much reading, literally maybe an hour. There are 3 links inside my book that you should click on and read more about my work, about my unique quantum food sensitivity assessment examination that we perform on every patient, about my quantum dental assessment, as well as on the very last page, I highly recommend, because you're going to want to know how I do what I do for people. I give a brief insight to that on my journey as a physician to become your physician who gives you the answers, as well as into my method of how I'm doing what I'm doing and the science behind it. On the very last page, click that link. It brings you to a private page on my website. And on this page, you can watch a 42-minute video in where I'm presenting my journey as a physician, the type of labs I used to run, my education, my background, as well as my method, okay? All right, isn't that just incredible? Again, she did no other treatment, and the results are spectacular, what happened for her. So one more time, I'm going to show the report of the mammogram and the ultrasound from January of 2020. It shows here that there was a mass in the right breast at 4 o'clock measuring 9 millimeters, and there was a mass at 12 o'clock in the left breast measuring 12 millimeters. They recommended that she should get a biopsy. The ultrasound from January of 2020, and it shows the right breast, there is a benign cyst at 3 o'clock measuring 6 millimeters, another one in the right breast at 5 o'clock measuring 6 millimeters, and it also shows that at 10 o'clock in the right breast measuring 3 millimeters. On the left breast from this ultrasound of January of 20, it shows that she had a 2 o'clock of 9 millimeters and that she had an 11 o'clock of 3 millimeters. We're going to keep some information up on the side here as I show you some more images so you can compare. We're going to show how many masses and where they were in the right breast and left breast from the ultrasound in the January of 2020 visit with her medical doctor. After she had already started care with me, the next ultrasound revealed that there is a resolving mass in the right breast, and it shows that there is still a problem in the left breast at 11 o'clock. Excuse me, this was from the mammography, sorry. The follow-up mammography of April of 2021 shows that there is resolving mass in the right breast and there is still a mass in the left breast at 11 o'clock. Well, the ultrasound revealed on the same day, April 20th of 2021, the ultrasound assessment of the right breast fails to reveal any significant cyst or solid breast mass. Now, this is after 2 treatments with me already. I'll get to those findings of my exams in just a moment. The ultrasound of the left breast suggests a small solid nodule and a small complicated cyst at 10 o'clock in the left breast measuring 4 millimeters, and also that there is a solid nodule at 2 o'clock, and that nodule is 7 by 3 by 6 millimeters. 2 small, well-circumscribed solid nodules in the left breast. She had another follow-up ultrasound September of 21, and the September of 21 ultrasound of the right breast fails to reveal any significant cyst or breast mass. This is already after more than 2 treatments with me. The ultrasound of the left breast suggests a small cyst at 2 o'clock, measuring 6 millimeters, and that's all it measures at that time. Okay. Next report, again, April 22nd of 2022, the mammogram, no dominant breast masses, and the ultrasound, April 22nd of 2022, the ultrasound of the right breast fails to reveal any significant cyst or solid breast mass, and the ultrasound of the left breast fails to reveal any significant focal cyst or breast mass in the left breast. Awesome. Now, I believe from my studies in immunology and in many other areas of science of the human body, in immunology, the studies were revealed to me as a student at the time that there are infections and chemicals that get into certain tissues and activation of mast cells that also cause inflammation in certain tissues. These infections, these toxins, and activation of mast cells lead to the inflammation response, lead to the type of cyst, lead to masses that appear in the body. I designed a system where I can non-invasively inspect how to find and diagnose which infections and or chemicals in activated mast cells can exist in a certain tissue and provide safe and effective, on a quantum level, safe and effective treatment to help the body help itself remove these different infections and chemicals and neutralize the activated mast cell to reduce the swelling, to reduce the cyst, to help the body just get rid of it on its own. So in her first examination with me, May 7th of 2020, I found that there was staph bacteria that was infecting the right breast and the left breast. I found that there was histoplasma fungus in the right breast and the left breast. I found parasitic infection in the right breast. I found aspergillus fungus in the left breast. I also found that she had staph and other bacteria infecting her lymph tissues. In July of 2020, she came back for another visit. And between the 2 visits, between May and July, I had her remove an infected root canal that I discovered in my unique quantum dental examination of her mouth. I found that there was infection in the root canal, and we were able to find in the exam that the root canal had infected her lymph, the root canal infected her left breast, the root canal infected the right breast, the root canal infected certain blood vessels and lymph nodes and organs, including the spleen, including her liver. We need the whole body to be functioning at top notch. We need to be able to get rid of the causes of the disease, get rid of the infections, and let the body heal itself. Well, she then followed the unique protocol I designed for her to help the body help itself rid the infections from the root canal that were in the left breast and the lymph and the right breast and other parts of the body. Now, furthermore, I found that she had, I believe, the measles virus was also infecting the left breast and the right breast as well. And those, I believe, were totally eradicated. Those unique exam findings, those infections were totally eradicated with the treatment that I offered. Again, you can learn more, read my book, download your free copy to my free ebook on my website, look through my website, watch the videos that are on my website, and you'll understand more from where I am coming from to help the body help itself rid its disease. So why do I feel that those were effective? Well, because again, if we look back at the ultrasound reports, you'll see how it went from a transition of having multiple masses in the right and left breast down to no masses in the right and left breast. And you see the transition when it became less masses, no masses in the right, one in the left, None in the end. I found with her in April and October when I examined her, April, multiple different candida fungal infections in the right and left breast at a very high amount. Multiple mold infections in the right and left breast. Multiple mold and candida infections in her lymph, in her spleen, in the muscles of the body as well, and in the liver. She had followed the protocol to rid those infections. How do I know the body rid them? Because we see that there are no masses again in her right and her left breast. In her October visit, we targeted activated mast cells that were in the breast tissue and in her lymph system. And again, the end result is that there are no more masses, no more cysts, no more growths in her right and her left breast. And that's pretty amazing. So I believe that with my work, I can help you get better too. I believe that you do have a chance to clear these growths up in any tissue in your body with my help. And it may take longer for you than what it took for her. It may take less time for you than what it took for her. I'll tell you that nobody knows from the outset of care. No, we don't know how many different pieces of the puzzle have led to your condition or another person's condition. Listen, an analogy that I like to use, if you like the Statue of Liberty and you like puzzles to put them together, puzzles that you actually put the pieces together and make a picture at the end, and you went to a toy store and you found that there were Statue of Liberty puzzles, and you found 2 boxes of puzzles, identical picture on the cover. They're both going to be a 3-foot by 5-foot picture when they're completed. Box A of the Statue of Liberty, 3 by 5. Box A only has 10 pieces you put together. Box B has 1,000 pieces you have to put together. They're both, when they're done, are the Statue of Liberty, 3-foot by 5-foot, identical picture. One was 10 pieces, one was 1,000 pieces. When you put that 10-piece puzzle together to complete the picture, it's probably only going to take you maybe not even an hour. The 1,000-piece puzzle, that might take you many months, depending on how many hours you're going to put them together, you're going to have in the day to put them together, and also depending on how skilled you are, how many puzzles you've actually worked with and put together before. So understand that it may take longer for you than her, it may be faster for you than her, and the more work that I do with this work that I'm doing, it may just be faster for you than what it even took for her to resolve these masses in her breast. But the job can be done for you like it has been done for her. I'm excited for her. She's excited as well. She was a little shy of the camera, but I'm glad that she got in on camera with me to help you understand that it was from this work and only this work that I offered her my treatment in order to help her totally resolve this. If you'd like to make an appointment with me to see what we can do for you, you can contact my clinic very easily. Just call this number, 954-370-3100. Or you can easily book your own appointment right on my website. There is a book appointment link that you click on every page of my website. It's very simple. You can use their calendar, you can book it, you can pay for the appointments right there. And by the way, insurance does not recognize my work. They will not pay for your care. Fortunately, we have the skill set. Fortunately, we have the right tools that can help you help yourself clean your body from different things that appear like masses in the breast tissue. Unfortunately, insurance companies, they just don't recognize this work. Yet fortunately, we can get it done. In the end, you are your best investment. You do have to invest in yourself, and that's just the way that it is. I look forward to helping you. Let's get the job done. Take action now, because there may be no tomorrow. I look forward to helping you. See you soon.